It's time to focus on seniors with Helping Seniors TV. The television show designed to make you aware of senior issues and needs, as well as to acquaint you with the resources available to help you age in place and with dignity. Now, here's your host, Joe Steckler.
I'm Joe Steckler, and welcome to Helping Seniors, the television arm of Helping Seniors of Brevard County. Our show is designed to provide you with information on how to develop your own aging and care plans. Our topic today is Podiatry Care, and joining me is Dr. Martin Lenoci of Osler Medical. Do you know Dave Russell?
I do know Dave Russell, yes. He's our administrator, yes.
I know he is. Yeah. I followed him around when he started out with the Duke Spine Clinic and then down to the hospital in Indian River County, and now he's back up here with Osler.
Right, he's with us. We're very fortunate to have him.
Yeah. He's a pretty good money man.
He's a good man.
Yeah, but we're not going to talk about Dave Russell. We're going to talk about foot care. And I know that generally speaking, foot care is a neglected part of the body, my opinion.
Well, a lot of people forget about their feet until something goes wrong, and then they realize how important their feet are once a problem arises.
But people don't think, Dr. Lenoci, that they're going to have problems with their feet. I think we stand on them so much, and we don't look at our feet like we look at our hands or look at our arms. We don't see bruises on our feet like we see bruises on our arms. So I think the average person, if they're not really versed in the importance of foot care, tends to neglect it.
Well, it's true. Feet you stand on them, people step on them, you kick things with them. Some people have trouble seeing their feet, and oftentimes problems come up and people don't even realize it. They'll come in the office and I'll say, "How long has that been there?" And I just noticed it yesterday, but I know that that's been there for weeks, and it just recently came to their
You
attention.
touched on one of the greatest, what should be one of the greatest areas of concern for senior citizens: not being able to see your feet. You know, if I get in my bathroom and I get my tool kit out to work on my feet, and my first problem is, with my glasses, I can't really see. I can feel the nail that needs to be cut, but trying to get that foot up on my lap where I can cut that toenail is another problem. So now I'm forced to sort of cut my toenails by feel. That's dangerous.
It is dangerous, particularly as you age. Your circulation isn't as good as it used to be. Some people it's worse than others. Some people have true peripheral vascular disease. Other people just have bad circulation which is getting worse. Some people have diabetes, which further complicates foot problems, and can't see your feet, can't reach your feet, and problems can happen. And even simple nail care. And we run a clinic at the office. Patients come in, we have medical assistants who help them with their nail care. I come in, examine them, make sure that there's no problems going on. And it's an ongoing situation for a lot of patients. They just come in on a regular basis and for just generalized foot care, and is very valuable service to a lot of seniors.
When I was in the military, we were required to get an annual physical. I retired. In the civilian world, there's no requirement for an annual physical. Some of the bigger companies, in order to keep some of their executives in better condition, they require a physical. Are you aware of any company that requires a foot exam?
Well, no. However, the American Diabetes Association does recommend annual foot exams for diabetic patients, and many of the managed care programs actually put that as a line item prerequisite for comprehensive medical care for diabetics to have annual foot exams. So there is an awareness growing out there, maybe not as much as there ought to be, but people recognize the importance of that.
Well, you have touched on probably the single most important thing, at least I think it's the single most important thing that seniors should be more aware of involving care of the feet and diabetic conditions. If you are a diabetic, you need to pay extra special attention to the care of your feet. And how should you do that?
Well, that's absolutely true. In diabetes, you have the classic triad of bad circulation, peripheral vascular disease. Diabetics can often lose sensation in their feet. So you have the neuropathy component of the triad. And then you have an immunological component where diabetics become less able to fight off an infection. So those three components will work together. And in a simple problem, whether it be an infected ingrown toenail or stepping on an object to get a small cut, the individual might not notice it right away. And a small problem becomes a deeper infection. They don't feel it. The infection gets deeper. If they have bad circulation, a lot of times by the time they come in to see us, sometimes the limb is not even salvageable. And more than one diabetic has lost a leg because of something as simple as an ingrown nail infection.
When I had come to the Navy home in Gulfport, Mississippi, my last job in the Navy, one of my biggest concerns was the podiatry problems that my senior citizens there had. And as I think about it, the average age of the person there was 77. I'm well past that now. So I am now more familiar with the problems that these people had when I was a young man. And it's caused me to realize that we have certain aspects of our medical treatment program in the United States that we could probably do a better job. And I think starting with our foot foundation, we could do a better job. It's just like I think that we have failed to give correct attention to oral health care, dental care. I think we could do a better job with that, especially with orthodontistry. I think very definitely we should do a better job of citing the problems that can come about as a result of poor foot care. I'm sure that you've seen older people that have come into your office for treatment. You make a mistake of you're pulling a piece of a nail off, thinking that it's dead. It's not, and people will cut too closely into and you get an infection in the foot, and don't realize the importance of correctly medically treating wounds in the feet. How big of a concern is this to you, Dr. Lenoci, as a podiatrist?
Well, it's always a concern, and especially with seniors who their overall health is generally on the decline anyway. They look at, as time goes on, everything starts to wear out, including your circulation, including your ability to fight an infection. And the last thing any senior needs is something which threatens them or something which compromises them. And a small problem becomes a big problem. And we like to catch things early, and we encourage patients to come in for whatever problem they think, no matter how small. And
what can seniors do through exercise, and what can we do a better job of in how we address care of our feet through exercise? We're talking about running, we're talking about walking, we're talking about riding a bicycle. One of the smart, sensible things seniors should do, realizing that our joints do wear out more, and they're not as elastic when we're older. What can we do to lessen the impact of causing podiatry type problems, doctor?
Right, and that's something which I see a lot of. A lot of people start off with very good intents. They want to exercise. And maybe they see their physician, they see something on TV that says you need to exercise. And the easiest thing to do is maybe to go out and walk. Some people will start walking. They figure, well, I used to jog when I was 30. It was 50 years ago for some people. And they might break into a jog and not realizing that they don't have a 30-year-old or an 18-year-old foot anymore. And oftentimes a senior foot will not withstand the stress and strain of jogging or even walking for exercise. And people don't realize that until it's too late. They'll go out, they'll start a program, and within a month or two, they develop pain in their foot. They'll come in the office, and that pain is often either a stress fracture, or it's a torn tendon, or a torn ligament, and now they're compromised, and they can't even walk to the mailbox without pain anymore. And that's preventable. It's preventable through better advice as far as how to exercise safely. And that information is out there, but there's a lot of well-intended bad information too. So it gets a little confusing for seniors.
What are some of the better types of shoes that senior citizens should be wearing as opposed to some of them that they wear because they don't cost as much? I'm sure that's a proper, correct footwear becomes, I think, more important as we get older.
Well, it's important for everybody. Again, seniors are in a special category because parts wear out, and a senior body might need more help than an 18-year-old body, but still, in my opinion, functional shoes are appropriate depending upon what you're doing. And I see a lot of seniors or a lot of individuals in general, they're out at Disney in a pair of completely flat flip-flop sandals, and the day goes on and they wonder why their feet hurt. Or on a regular basis, I have patients come in, seniors, who say, I was doing fine until I went to Disney with the grandkids, and now I can't walk because my foot is swollen. Well, what were you wearing for shoes? Oh, my flip-flops. This doesn't work. And it happens all the time. And it's Florida. People like wearing sandals. It's a stylish thing to do, but it's not functional, and it gets a lot of people in trouble.
You see many older people walking around with the stockings on that, the pressure stockings. They have the same pressure things for the ankles. Mm-hmm. How should people that are not under a regular doctor's care, how should they be made more aware of the need, maybe possibly for using diuretics to relieve the water pressure in your legs? And because that's extremely important. And what was it called, like an edema to the legs?
It's called lymphedema. And look, I'm not an advocate of self-treating. Lymphedema can be a manifestation of a systemic problem, a weak heart, bad lungs, bad kidneys. When we see patients come in with lymphedema, we make sure they're evaluated by their primary care physician. And the Wuesthoff Hospital runs a great lymphedema clinic, which we support, and we try to send our patients to the clinic. They do a great job in teaching these patients how to control their lymphedema. They have a great therapeutic program that they put these patients through. Then they get them fitted with proper compression stockings and proper education, because it's a process. You can't cure lymphedema. You manage it and you control it, but you don't cure it. So it's an ongoing thing, and these patients really should be supervised.
What causes it?
Well, again, it could be caused on either end of the spectrum. Why are they retaining fluid? Why are they retaining fluid? Because they're not getting rid of it through their kidneys? Well, that's a medical problem. Are they in congestive heart failure, or is it a plumbing problem, right? Are the veins in their legs just no longer working properly? Gravity's constantly pulling fluid down. So if the valves in your vessels go bad, that fluid tends to pool, can't get back up. So it's a complex issue which patients really should be managed by their physicians in order to properly and safely deal with it.
Many people, it's my belief that many people go to their primary care doctor and they tell the primary care doctor what is the most obvious thing that they want to tell them, but they have problems with other parts of their body that for any number of reasons they don't tell that primary care physician, and they are probably doing themselves the greatest disservice for the very reasons you've just described, and especially in the case of water retention. I know in my own case that since I've had a dissecting aorta, and it's been sewed and glued back together, and I've had a stroke, and I have atrial fibrillation, I have fibromyalgia, I have a lot of problems, but I know that water retention is a problem of mine, and I know that if I'm fortunate because my cardiologist has pointed these things out to me and he has given me directions on what I should do if this conditions exist at the time. And I take my blood pressure every morning and every night. And if it's outside of a certain parameter, then I take 1 or 2 hydralazines to short-term effect lower the blood pressure. But not everybody's going to do that. Not everybody's going to pay that close attention to their blood pressure, and they're not going to pay that close attention or tell their cardiologist or the primary care physician about all these other things. So it makes it so much more important that people understand that probably one of the greatest assets for control of personal medical problems is the person themselves, by recognizing what's happening in their body and telling their doctor.
Right. Yeah, it's very frustrating. I don't have the answer. Some people take better care of their automobile than they do their body, and I can't understand it. But people should be proactive in their health, and they should listen to their body, and they should pay attention to changes in their body and seek advice from their physician.
But what you're doing, Dr. Lenoci, is you're pointing out to people that when we start talking about the underpinnings of the rest of our body, that we don't pay enough attention to the underpinnings as we do to the body itself. Many of the problems up here are manifested down in our feet and our lower legs.
Right.
And if I don't tell my primary care physician about those problems, what chance do I have to alleviate that problem or correct it or get myself in a better health condition?
Right. It won't happen. It'll just continue getting worse until the source of the problem is addressed.
Yeah. And when we did our radio show, we talked about several things, and you had some very good pointers for our radio audience about things to do and not do when you're starting an exercise program. Could you expand on those for our television audience too?
And we talked a little bit after the show. We talked about Chris Crowley's book, Younger Next Year. And that is an example of some very good information which is out there. Because there's some very bad information which is out there. There's a lot of training programs and that they're very well intentioned, but the individual instructors sometimes will treat a senior body as if they're training the next Olympic athlete. And I see a lot of patients coming in who have signed up for these various exercise programs which are out there, and they come in with one overuse injury after another, again, whether it be a stress fracture or a torn tendon, torn ligament, and they're just doing too much too soon. So the first thing that seniors need to do is to seek really good, sound advice. And that particular resource is a great resource. He has a website too. It's youngernextyear.com. And he advocates, as an example, using a stationary bicycle for your cardiovascular fitness as opposed to trying to go out and walk or certainly jog. That's very dangerous for many seniors. And it's great advice. Certainly, every senior should first be cleared by their physician, right? Make sure their heart is strong enough for exercise. And for most physicians, that's where it's going to end. They're going to say, yep, your heart's strong enough for exercise, go exercise. That doesn't help the senior. It doesn't help anybody. And so where do they go? What do they do? I agree with Chris Crawley's theory. Get a stationary bike. It's safe. You're not going to fall off it. You're not going to get hit by a car. From a musculoskeletal standpoint, it's much easier on your joints. You're able to get your heart rate up to a target heart rate. You get a great cardiovascular workout that way. And then you can do your other things. You can go out for a little walk. You can do your stretching, some light weight lifting for your strength and that sort of thing. And try to be aware that you don't over push your body. Because what a lot of individuals don't realize, there's two components of fitness. You have a cardiovascular component, and then you have a musculoskeletal component. And the two do not stay parallel as they either improve or decline. When you're 18, you can go out and you can push yourself as hard as you want, and your heart and your lungs will get stronger, and probably your muscles and bones and tendons will get stronger, probably, not always, but probably. And that works, and that's what they do in the military and basic training. But when you're 75, you can't do that. If you try that technique, then yeah, your heart and lung will get stronger, but you can only push your musculoskeletal system so far until it starts going the other way. And the natural tendency for a lot of people is, I can take the pain, so I'm going to push through it. You know, my knee hurts, my hip hurts, my foot hurts, my ankle hurts, but I'm going to keep going because that's what you do when you exercise. You push through the pain. Well, no, that's not what you do, because you end up in my office or someone's office with a stress fracture or a torn tendon, and then you do nothing for a while all that heals, and that's no good. So getting proper advice is very important. And,
yeah. And you have to heed that advice. I remember when you were talking about a stress fracture, I was playing football at the Naval Academy, and I took a pretty good hit one day, and I had to leave the field, and they wrapped my leg that night, and they did an x-ray. They read it wet. So I was back at practice next day playing football at the Naval Academy, and I went for like that for 3 weeks, and I just couldn't hardly walk. I was getting killed, and they read the x-ray. It had dried. I had a stress fracture. I'd been playing football for 3 weeks with a stress fracture in my lower left leg. I wrecked my football playing days. I couldn't play after that. My leg wouldn't take it. But, you know, care of the feet is just like any other part of care of the body. If you ignore the symptoms, if you ignore what your body is telling you, you stand a great chance to do greater harm. As a podiatrist, what are some of the other things that you have seen? We've talked about exercise, we talked about foot care, we talked about shoes. What are some of the other greatest concerns that Dr. Martin Lenoci has about foot care that our viewing audience might think about?
Well, for seniors, it stays fairly within those realms. Some seniors come in, they've got this crooked toe or this bunion, and they want it fixed. And I get to talking to them. It's like, well, how long has that been there? 20 years. Well, does it bother you? No. Well, why do you want to fix this? Well, because it's there. So there is some confusion out there. People will see advertisements or whatever for reconstructive foot surgeries and think that they need to do that just because their foot's not perfect. Well, I generally try to discourage them from that. And it's doable. You know, some people legitimately do have a crooked toe that rubs against their shoe and constantly is getting an open sore, and they just can't wear a shoe. And for some of those individuals, it is worth it to maybe fix that toe. And we'll do that.
Well, I got a hammer toe on my left foot, but the only person that sees is my wife, so I'm not going to worry about my hammer toe.
Yeah.
Or if I'm sitting by my pool trying to sun myself, and which I'm not doing as much as I should, you make light of things, but these are serious things. I think, and I go right back to the very first thing I said when we started the show, care of the feet is one of the most ignored medical things that people in the United States and possibly the world do. We don't pay enough attention to the care of our feet. But I think if we have more doctors of your type talking about care of the feet on radio, on television, and more articles that people could read, people would have a better appreciation of what they can do to help provide better care for their own bodies. You have 24 seconds. What would you say?
Well, I would say listen to your body. Every day, there's at least one patient, usually more, who comes in with a problem that's been going on way too long. They've just been trying to push through it. And just always keep in mind the 6 most dangerous words in medicine is maybe it will go away. And
okay. Thank you, Doctor. Right on time, right on schedule. And I want to thank you, viewer, for watching today's episode of Helping Seniors with Dr. Martin Lenoci of Osler Medical. Thank you, Doctor.
Right, thank
Good
you.
show.